Welcome back to Fort Wayne's Smallest Winner. I'm Kent Horman. This is a segment I have really been looking forward to because this is something you might not think about in terms of your overall health and obesity. Pleased to be joined by Dr. Samuel Corey from SLC Dentistry. And Dr. Corey, somebody would say, okay, how does your oral health relate to obesity?
Well, I think in today's society, most people, when they think of dentistry, they think of how white their teeth are, how straight their teeth are. But there's a lot more going on than that. There's actually a disease process going on there. When we talk about your periodontal health, the supporting structures of your teeth, what holds your teeth in your jawbone, that relates to obesity quite a bit.
It may sound a little trite, but I've heard a lot of overall health it starts with your mouth, how good your oral health is. What are some of the diseases that you see as a dentist that are in relationship with obesity?
Well, one of the diseases is diabetes and the other is coronary artery disease. With diabetes, you have two types of diabetes. You have type 1, which is early onset or insulin-dependent diabetes, and then type 2, which you usually get later on in life. And with type 2 diabetes, there's a lot of contributing factors to that, but some of those factors are obesity and lack of activity or lack of exercise.
And heart disease, there can be some relationship between heart disease and oral hygiene?
Yes. With oral hygiene or lack of oral hygiene, what you're going to get is with periodontal disease is actually a bacterial infection that's going on underneath the gum line. And with this bacterial infection, it can get into your bloodstream, which is what we call a bacteremia, and that can lead to inflammation. There are studies out there that show a direct relationship between coronary artery disease and inflammation. And so what that inflammation does is it breaks down the inner lining of that coronary artery, makes it where it's not smooth like it should be, and you can get plaques or fatty deposits that accumulate on that artery. It can block the flow of blood to your heart to the point where you can actually have a heart attack.
And so then there actually can be a relationship between what's going on in your mouth and your oral hygiene. This one kind of stood me up. And strokes.
And strokes, absolutely. The same mechanism out there that affects coronary arteries can also affect the arteries that lead to your brain, the coronary arteries that supply blood to your brain. So you can get buildups there as well, which will diminish the amount of blood flow to your brain.
And this is kind of going back to what I just talked about with Dr. Roth when you talk about treatments and things like that. I suspect you can do a little bit more than just brush your teeth, but I suspect good oral health, I mean, that's the beginning, brushing your teeth. Flossing, I understand, is something that's very, very critical.
Absolutely, because periodontal disease in itself is an asymptomatic disease. People have no idea they have it usually. There are no signs or symptoms with that. And so flossing and good oral hygiene, going to the dentist twice a year to have a dentist check or your hygienist check to make sure there's no disease process going on there.
And and this is one of the things that is a little bit scary because it seems like your oral health or the way you take care of your teeth is somewhat of a generational thing depending upon your age. But also it seems like if people are a little bit obese, maybe they're a little lax in their oral health, and so they don't brush as often or they don't want to take those precautionary steps. So I suspect you can't stress enough. Take care of your mouth and your mouth will take care of you.
Right, absolutely. And that's part of the good thing about this program is, when people start to feel better about themselves, they start to take more considerations of how they look. And obviously they want their oral health to be, right there. And so if you have good oral health systemically, you should be healthy as well.
Dr. Corey, it's a pleasure to have you on the program. I really appreciate this insight because I think a lot of people would have thought, well, there could be no correlation or relationship whatsoever between your oral health and obesity and some of the things that go on with that. Again, this is Dr. Samuel Corey from SLC Dentistry. If you need more information, this is valuable information, here is how to contact Dr. Corey. Again, you can give him a call at 489-0078, Samuel L. Corey, and slcdentistry.com. Great advice, and this is a great way to improve your health, which then again can improve your overall look as far as you approach your body and trying to lose weight. It can start in your mouth in more ways than one. We'll be back with more of Fort Wayne's Smallest Winner. Stay with us.